Last time Dr. Salanski was on, he talked about Partners in Primary Care and their brand of senior-focused primary care that understands the healthcare needs of senior patients. Well, today he's back to dive into what makes Partners in Primary Care different. Welcome back.
Thanks, Crystal. It's great to be back.
So we were talking about this. You have a very specialized care team at Partners in Primary Care. Tell me what that means.
Well, our care team is really supported by the fact that we take patients with Medicare Advantage, which pays us differently to take care of the patients. And so it enabled us to put together a team that includes all the staff you would expect to have in an office. You know, medical assistant, front desk staff, people who handle medical records, referral coordinators. But we also have a care coach nurse who is able to call patients and follow up closely with them if they have chronic conditions like diabetes or high blood pressure or heart failure. They also call patients if they've been in the hospital, and we follow and closely check in on them to be sure that they're doing what we've asked them to do and that they're doing well. We also have a clinical pharmacist in each of our centers. In our standalone centers, as well as in our centers that are in Walgreens, we have a clinical pharmacist. And that pharmacist actually is a very important part of the team. They can talk to patients about their medications, review their medications, explain medications to the patient, clear up sometimes when patients are taking multiple medications or confused about their meds. They can instruct them in how to give themselves insulin injections or how to use inhalers. And they also help patients to find the best and most cost-effective way to get their medications. So the clinical pharmacist is a very important part of the team. We also have a behavioral health clinician who can work with our patients between our centers to help us with those patients who have mental illness or other behavioral concerns and issues. And we're going to be adding a social worker as well to help us because we're very interested in taking care of people with the social issues that affect their health care as well.
That is so incredible. And sometimes it is looking for those issues like isolation and depression and really focusing on the whole person, which I think is so incredible that you guys do there.
That's right.
So tell me more about how many locations do you have and how can people go in and learn more and make an appointment?
Well, we have 8 locations. 2 years ago, we opened 4 centers that were independent, freestanding, one in Independence, one in Midtown Kansas City, one in Kansas City, Kansas, one in Olathe. A year ago, we opened 2 centers that are actually within Walgreens, and one of those was in Raytown, another in Gladstone. And when people walk into those, they're very surprised to see a full doctor's office space within Walgreens. And then just a month or so ago, we opened a center in Grandview within the Walgreens there, and we are now in a soft opening, but we'll fully open in probably January to early February in Overland Park with another center that's within Walgreens.
Wow.
So these centers, particularly the one in Overland Park, we now have an opportunity for patients to they can be seen, but also to go in and see what we call the discovery experience, which helps them to understand what the whole space is going to look like. So there are opportunities to, you can look at our website and contact us for setting up a time to come in if you want to individually do that, or we have regularly scheduled open houses at all of our centers.
Oh, that's so great.
And we're also offering some opportunities for people to come in and learn about Medicare and the different Medicare products and the different Medicare Advantage products that anybody can come in and learn about those opportunities. Our activity centers are open for many different types of educational opportunities, as well as exercise and other things that our patients can benefit from to help them not only be out and away and not socially isolated, but also to help them with their health care needs.
So multiple ways to learn more and visit. If you would like more information, of course, you can visit any of those locations that we mentioned across the metro. Go online at partnersinprimarycare.com/Kansas-City, or you can give them a call at the number on your screen there as well. So many, many ways to get in contact and take care of your health needs. Thank you so much. It's good to see you again.
Thanks, Crystal. Great to see you.